Hello and Assalamu alaikum. I'm Yasmin Ahmad, lecturer at Dadaboy Institute of Higher Education. Today is May 17th, the day which is celebrated as World Hypertension Day since 2006. This year, the theme for World Hypertension Day is Know Your Numbers. The main aim is to increase awareness about your blood pressure. Let's discuss it. Few important facts about hypertension. You and I are member of world community that is about to approach 8 billion, and among us 1 billion suffers with hypertension. Alarming, isn't it? According to Blood Pressure UK, an organization helping you to lower your blood pressure, high blood pressure is the leading cause of heart disease and a stroke, killing around 7.5 million people worldwide every year. Now I would like to discuss something about hypertension. Hypertension is also known as high blood pressure. Human blood flows into various parts of the body through a system known as circulatory system. Like all fluids, the blood flowing through the human blood vessels exerts certain forces on the walls. Force exerted by the blood in the human circulatory system is known as blood pressure. Hypertension or high blood pressure is a term used to describe the condition in which the blood is exerting higher force against the walls of the blood vessels. I hope you all are feeling well. But when you visit doctors, have you noticed that the first thing they check is the blood pressure? And how do they write it? They write it in numbers like 120 by 80 mmHg, which is the normal blood pressure. Let's discuss something about this, what these numbers represent. As you know, that heart supply blood throughout the body by serving as a pump. This continuous beating of the heart, that is contraction and relaxation, actually causes the blood to go out into the body and comes back into the heart. The first number shows the systolic contraction, pumping of blood out, and it comes up to 120 in the above case, which is the normal blood pressure. The second number depicts the diastolic pressure. This is when the heart relaxes, and in normal cases it is usually 80. Now we will see what happened in hypertension. You can see the difference between a normal blood vessel and a narrowed blood vessel. When a person is having normal blood pressure, amount of blood entering exits the blood vessel easily. But if a person is suffering from hypertension, as the blood vessel is narrowed, thus the amount of blood entering the blood vessel is forced out of the vessel and thus causes high blood pressure. According to Center for Disease Control and Prevention, CDC, there are different ranges for blood pressure. Normal blood pressure is less than 120 by 80 mmHg. A person is at risk for high blood pressure, that is pre-hypertension, if the blood pressure falls between 120 by 80 mmHg and 139 by 89 mmHg. And a person is suffering from high blood pressure, which is also known as hypertension, if the blood pressure is more than 140 by 90 mmHg. Persistent high blood pressure can cause many complications within human body. It can cause elevated sugar levels in blood and can affect different organs of the body as well, like retina of the eye. It can cause hypertensive retinopathy. The heart can also be affected, causing heart attacks or even cardiomyopathy, heart failure. The kidneys are affected as well through hypertensive nephropathy. Chronic renal failure is the result. The brain is another organ which is affected due to high blood pressure, causing strokes and confusion, headache, and convulsion. The good news is that if you are smart enough, you can control high blood pressure without using any medicine. Here are some of the techniques: through weight control, through regular exercise, through healthy diets. One of the way is using dietary approach to stop hypertension, through reducing sodium levels in your diet, by quitting smoking, by controlling excessive caffeine intake, by reducing stress in our lives, through regular monitoring of blood pressure, exactly what we have discussed in the first slide. Know your numbers. The Dadaboy Institute of Higher Education is observing Hypertension Day 2019 with a sad note. This year, we lost our former rector, Professor Dr. Abbas Chaudhry, due to sudden cardiac arrest. May God bless him highest place in Jannah. Thank you for being with us. Take good care of yourself, your loved ones, and the wider community. And don't forget to know your numbers.